because I have a problem with my balance and standing on my feet for a long period of time and I need a crutch to help me walk, I'm now labeled as disabled.
Disabled is the last word you would use to describe Siobhan Thurman. She is fiercely independent, a full-time graduate student at UCCS, pursuing her doctorate in communications. But for the past 10 years, she has been engaged in a daily life lesson dealing with the debilitating consequences of MS.
I was scared, very, very scared. And it was really hard for me when I first was diagnosed because I didn't know what it was.
She's been very proactive the past decade in better understanding MS and the impact on her body. It's gradually affected movement on her right side. She struggles with balance issues and it's affected her eyesight. In the simplest terms, MS affects the ability of nerve cells in the brain and spinal cord to communicate with each other. In MS patients, the body's own immune system attacks and damages the tissue that surrounds the nerves, potentially impacting every part of the body.
So almost if you think about it from an electrician standpoint, is the wire is firing, but there's something, the lesion there is blocking that pathway, so the electric current is just not flowing properly.
It can be difficult to diagnose because its symptoms are similar to many other medical problems. Warning signs include a tingling sensation at the extremities, numbness, muscle weakness, spasms, difficulty moving, problems with speech or sight. Current medications work to slow its progression, and while life expectancy of MS patients is nearly the same as those unaffected by it, finding a cure is the next step. And that's where the Walk MS Colorado comes into play, one of the largest fundraising events each year here in southern Colorado. Participation has grown 60%, fundraising 30% the past 3 years.
And along with that, so has our need from people who have identified themselves as having multiple sclerosis. So that number has drastically increased as well.
80% of the money raised stays right here to help people like Siobhan. Last year in Colorado, $3.5 million paid bills, funded equipment purchases, physical therapy, and outpatient resources.
That's been hard to break down barriers and saying it's okay to ask for help.
But that is what the MS Society is here for. Raising awareness is as important as raising money.
So the more visibility that we have through our fundraising events, the more that we can call people with MS and bring them out into our events so we can help them when that time comes.